Welcome to the Cyclical Doula podcast. I'm Emma, a certified fertility awareness educator, miscarriage doula, and the founder of MMA LLC. This space is for women who want to understand their bodies deeply, not just memorize information, but actually feel confident in interpreting their cycles. Here, we talk about ovulation, hormones, cervical mucus, basal body temperature, and all that messy in between emotional layers that come with being a woman. We talk about trying to conceive, avoiding pregnancy without hormones, postpartum transitions, pregnancy loss, perimenopause, and everything in between. Because body literacy isn't just about charting. It's about the autonomy. It's about informed consent. It's about not outsourcing your reproductive decisions to guesswork or fear. Each week, you'll hear conversations with women's health professionals, birth workers, educators, and researchers, along with solo episodes where I teach practical skills you can apply to your own cycle right away. If you have ever felt like you should have learned this information sooner, if you have ever felt disconnected from your cycle, if you want to raise the next generation without shame around their bodies, you are in the right place. So grab your tea, open up your notes app, and let's build cycle confidence together.
Welcome to the space where cycles breathe, where the real raw life of a mama leads, from motherhood's highs to charting the low. Your body's story is the star of the show.
Welcome back. Today, I'm joined by Christine, a registered dental hygienist, a certified health coach, and the voice behind the PCOS Glow Hygienist. Christine brings a powerful, often overlooked perspective to women's health by connecting oral health, inflammation, and hormone balance, especially for women living with PCOS. And I am so excited to have this conversation today and dive into all of these things that I think most people don't even talk about at all, let alone know how important it is. So welcome. I'm so excited to have you here.
Thank you so much. I'm so excited to be here and hear all the things you have to say, answer all the questions, do all the things.
Yeah, amazing. So, with us getting started, I'd love to just hear a little bit more about who you are as a human being. So tell us a little bit more
Right.
just who you
Yes.
are.
Yeah. So I am a wife, a mother of 4 now adult children. I can't even believe I'm saying that out loud, but that is
That's crazy.
true. I am a dog lover. I have 1 dog, Oakley, and she adds craziness to our life in the best way. I love anything art, specifically making jewelry, dabbling into painting and any other thing that I can kind of get that creative juices out in. I love pretty much everything in nature, going for walks, hanging out with friends. I love tea, so many things, so many things.
Amazing. I love that. Um, okay, so let's dive right into us. Tell us how you
Yeah.
got into, I'm assuming you went to dental hygiene school to start off, but maybe not. And tell us how you got into this niche of what you're doing.
Yeah, for sure. Oh, yeah, exactly that. I was in the dental field. I started and I got my dental assisting, and then I worked for a year, and then went back and I got into dental hygiene, and I did that. And then I did dental hygiene, traditional in clinic, in operatory, seeing patients for 20 years, a little over 20 years, off and on, had babies in between, did part-time, did lots of things in that whole field, and loved it. I
Yeah.
still love it.
Mm-hmm.
My favorite part was always talking with patients, clients, and answering their questions and talking about health in general and all these sorts of things. While that was kind of happening, I also had been diagnosed as a teenager with PCOS. And so I had been dealing with that, my whole life, essentially, my whole adult life. And so that's kind of how the two worlds started going parallel and then eventually kind of met up. So after doing all this in clinic, in operatory stuff, I just felt like there was like a bigger picture that I wanted to look at because
Yeah.
with oral health, a lot of times it just gets stuck in a dentist's office, in a dental operatory, which is fabulous that it's there, but there's just
Hmm.
so much more. And so it was probably, honestly, probably almost a decade ago was the first time I probably heard about this like oral systemic, which is like mouth body connection. And I was like,
Okay.
what is this? And what are they talking about? And all of that. And that was kind of the start of where I now am starting, just like the start of it
Yeah.
kind of thing. Yeah.
Amazing. So this is so cool. I have so many questions. I ironically feel like I have like a good knowledge of some dental stuff because in high school, my like
Yeah.
first job, I helped out in a dental office, like didn't file
Yeah.
paperwork. So I like have this like teeny tiny knowledge of dental work.
Yeah.
And then obviously like I get my teeth cleaned, but I feel like this is something that's not talked about a lot. And as you mentioned, it seems like it's nothing, like it's not something that's talked about. People know about like generally going to the dentist to have some typical cleanings and stuff like that, but this connection of looking at it in a whole body way is not something that's often talked about. Is that correct?
It's
Or am I just
correct.
okay under a rock? Yeah.
Yeah. No, that's correct. It's getting out there more
Yeah.
for various reasons. One, it's undeniable if you start looking at literature. I would say the
Right.
first the biggest connection was probably heart or cardiac connection
Mm,
was probably one of the big ones, or diabetics, people who have diabetes, and there's a lot of oral health things. So I think it kind of started in that kind of area. And now I did a certification specifically in this oral systemic health. And
yeah.
literally now it is the whole body. And it's not
Yeah.
just the dental world, it's the medical world as well taking notice. It's the big institutions that are now starting to do research on it and try to find more of these connections. And there's a lot that believe that some of the big advances in medicine will actually come from dentistry
Yeah.
slash oral health.
Yeah.
Um, Lots of things to do with like saliva testing and what kind of
Mm,
bacteria you have in your mouth and like correlations between bacteria loads and disease, and it's its whole own specialty, but
yeah.
super exciting.
That's amazing. And I think like what a cool time to be in of how being able to like understand that this is all taking place and that there's going to be so much growth in that too.
Yes.
What is one of the things that you see that like initially when you people start learning about oral systemic health that you like want everybody to know, which I'm sure like there's so much, but let's start with one thing.
Right. So one thing, the most basic thing is that it's connected, right?
Yeah.
Our mouth has always been part of our body. And from years and years and years ago, we separated it. And it's
Mm,
interesting because no other body part has been separated. And it
yeah.
gives us such a unique perspective because if you have, let's say, a heart issue, for example, we can't just pull your chest open and take a look at it easily, but we
Mm,
can see in the mouth. So we can see a lot of things in the mouth before we see it in the body.
yeah.
So it gives us this unique kind of opportunity, and it's often referred to as the window into the body. So you
Hmm.
can see, kind of have a snapshot of what might be happening in the places that we can't easily see without surgery or that type
Yeah.
of stuff. Hmm.
Absolutely. That's so fascinating to me. So I because you have this like specific part of working and like having knowledge around people with PCOS and their oral
Hmm.
systemic health, what is one of the things that you see that's so specific to women who have PCOS in their oral health?
Right. So PCS is very complex in and of itself.
For sure.
Yeah, because every woman has different symptoms depending on what they have going on. It's
Right.
hormonal endocrine based, but to what level and what hormones and all these things. So there's no like exact one thing with PCOS, which makes it really tricky. But I think I can safely say across the board, there's inflammation in women who have PCOS. They have an increased inflammation in their body, like chronic inflammation.
Right.
And so often in the mouth, you will see inflammation. And that could be in their gums are kind of puffy, or maybe they bleed easily, or maybe they have some issues in their mouth, like dry mouth. They're really at
Mm.
high levels of sleep apnea. A lot of women with PCOS have sleep apnea. So there's just all kinds of things that we can see. But I would say across the board, regardless of what your symptoms are with PCOS, often the dentist will see or hygienist inflammation in the mouth.
Yeah.
Yeah.
That totally makes sense that would be correlating that, like, if you have inflammation anywhere, obviously it would be present in your mouth as well.
Yeah.
Um, so you mentioned that it's going to be so specific to the individual about what PCOS is kind of showing up in someone's body, which we
Hmm.
know. Do you use that same approach with their dental care and oral care of how, like, it being so personalized?
It is. It really is. And
Yeah.
so I do a lot of coaching. A lot of it's virtual. So I'm not seeing them in the dental chair in a dental
Yeah.
operatory. But we can get all of their information from their dentist slash dental hygienist. And so we can work with that. And often they have really great results. They'll go back in their 4 month or 6 month recall and they'll be like, what have you been doing? Because it looks fabulous in here. And it's just some of the tweaks and differences that we use, and that they're not like big lifestyle going to take you forever,
Mhm.
but it can make big changes in the inflammation in your mouth. Because there's lots of things that you hear in the dental world, but it tends to be the same things: brush
Yeah.
your teeth, floss your,
Yeah.
those kinds of things. But there's also other things that we can do, and it's just individualized because we want to get that inflammation down. That's
Yeah.
super important. And it's an amazing opportunity. And that's why I get so excited, as you can hear, as I talk and talk about this. But um, it's a real opportunity because there's other areas where it's much harder to address systemic inflammation.
Yeah. So
Hmm.
what are, obviously, like, this is going to be so personalized to the individual. So if anybody's
Hmm.
listening, this is not medical advice for you,
Nope. Yeah.
but what are some ideas of, like, what are some people doing to kind of reduce that and see some results?
Right. So, regardless of anything, the tongue is often forgotten.
Okay.
The tongue can tell us so much. It can be coated in stuff. It
Mhm.
can, give a bad taste, all sorts of things. And so, just starting to clean your tongue regularly can make a huge difference. That can reduce bacteria by up to 70%. So
Wow.
that is huge,
Yeah.
if we're trying to reduce inflammation in the mouth. So that's just
Mhm.
one thing that generally you want to have as part of your oral health is a tongue cleaning routine, or however you want to do it. But yeah, that should
Yeah.
definitely be part of it.
Yeah. That's awesome. I think, like you said, that's not something that we really are taught very early on. Like, I have a 6-year-old and a 4-year-old, and I don't clean my tongue very often. So, like, it doesn't even, like, cross my mind that that's something that I should be teaching them. But now I will. But
Yeah.
yeah, those are great. Those are great things. And so when you're working with people, are you mostly working just on their, like, oral hygiene and their oral health, or are you, like, looking at them as a whole person and looking at all of that as well?
Right. I look at everything. We look at
Yeah.
all aspects. I just can add in that oral mouth body connection
Right.
because of
Right.
my background, but by no means is that all I do.
Right.
I have all my health coaching certifications and whatever. So we look
Hmm.
at everything. We want to
Yeah.
look at your from a medical stance, right? Like all the markers for health.
Yeah.
What's your blood pressure? What's your A1C? Like, what are your blood sugars?
Hmm.
What's your daily habits in terms of exercise and diet, and what's your sleep habits? And so I comprehensively look at everything. I
Yeah.
just add in that oral health part because it is a difference maker, and there's not
Yeah.
very many people that do it or have the knowledge to do it. So it's
Hmm.
like I don't want to say added bonus, but
Yeah, no, but it is. It is.
yeah, yeah,
It's another way of looking at it, and you have such a good background of knowledge around that, which is really important.
yes, yeah.
Do you feel like there's consistent things that come up when you're working with people with around PCOS that you're like correcting myths with it, or do you feel like people have a good understanding of what PCOS is?
Think there are myths, and I think part of it is there was zero information out there. And
Mhm.
then now there's lots of information, but it's not necessarily correct information. Everything that
Mhm.
I do is science based, research based, and backed up. There's hacks and pills and patches and all kinds of things that are supposed to fix things.
Yeah.
Um, it is a chronic disease. There is no one single anything that is going to take care of it forever and ever, but
Yeah.
there is lots of ways to manage symptoms so that it is like you don't have to deal with it every single day of your life. And so that is the goal with most people that I work with, rather than it being the focal point of their life and they're really struggling. We get things into their life and their lifestyle that make it just a part that they manage, and then they can go do all the things that they love to do, and it's not sucking their energy and their time and their money, and they can focus on their kids and family and work and all the things that can be really affected by some of those symptoms of PCOS.
Yeah, that's amazing. I think
Hmm.
that that's again, like everybody just kind of wants that relief to some degree of some of those symptoms, and being
Absolutely.
able to have a bunch of tools to be able to help people through that is so good.
Yes.
Do you what are some of the things that you see the people that you work with just like having this like light bulb of a changing moment as they're working with you?
Right. I think one thing that I see like just so often is there's more than one way to achieve things or to do it.
Mhm.
And that we wanna go for sustainability over direct results. Like, everybody would
Yeah.
love to do whatever in 10 days, but
Mhm.
if we do it that quick, it's probably gonna fall off that quick. Like,
Yeah.
statistically, that's how it works, unfortunately.
Mhm.
So we want to like rather than going in and changing their whole life, like pick out things that need work and where do we want to put the work in and where's the most bang for your buck and how can we add this to what you're already doing? Like so many women that I work with, they're busy women, like they've got
Mm.
careers, they've got kids, like they don't have like all this time all the time to like be able to do everything that they wish they could.
Yep.
So I totally relate to that. I myself have 4 children. And so I know what that's like. And I think that is helpful when I work with clients because they're going through a similar thing, right? It's not
Yeah.
they're just taking care of themselves because then it's like, well, I'm going to work out from this time to this time and I'm going to eat this perfect way. And, it's tricky if you've got kids and this one won't eat white
Mhm.
food and that one's, doing, and you're trying to like mix it all together. And that's how we can
Yeah.
get some personalization going in there so that they can achieve their goals. But it's still real life, real women,
Yeah,
for sure.
absolutely. Because I think that's one of the things, like, as so many women, especially moms who have little kids,
Hmm.
are kind of in that season of like, okay, like I want to make this overall. overall like health change, but I don't
Mhm.
have the capacity to like rehaul everything, and being able to make those small steps and have support through that really is helpful.
Yeah, yeah, no, exactly. And there's lots of things that we can do and lots of movement in lots of different ways. So that's the exciting part about coaching and why I love it so much because everybody is an individual and everybody has different goals. And so
Mhm.
we can really work together to see what works for them so they can achieve their goals.
Yes, that's so good. I love that so much. I wonder, do you, as you're working with clients, obviously women who are cycling on a regular basis, there's a lot of things that change with all of that.
Hmm.
Out of my own curiosity, do you see
Yeah.
changes in people's oral health or like what their mouths are doing during different parts of their cycle?
Yeah, we can, especially if they're on their period or just started their period.
Okay.
Often they can have an increased sensitivity to like pain or pain. Their pain
Mm,
receptors are like super sensitive. So
yeah.
sometimes, someone will come in and it's like, I don't know why. And then we just never book another appointment at
Yeah.
that time of their cycle. Hormones can do really strange things to the oral tissue as well.
Right.
There's a actual like hormonal pregnancy gingivitis, we call it. So
Right.
gingivitis is just inflammation of the gums. And so women will be, maybe in that, excuse me, first trimester, and they'll come in and they're like, I don't know what's going on. My gums are like bleeding all the time. Like, I just go to brush
Yeah.
my teeth and they're just bleeding. And I don't know why. Like, I'm doing the exact same thing that I've done for, 20 years before this.
Mhm.
And it's just the change in the hormones. The
Yeah.
body's reacting different to, let's say, maybe some bacteria loads and that kind of stuff. And so you'll see this. And so, then we do all the things so we can get it back under control and as their hormones, kind of regulate and maybe aren't going quite as crazy because that first trimester, of course, they can go from 0 to like
F
600.
for sure.
So yeah. So yeah, no, you can specifically see things.
That's really, like, it's just mind-blowing to me and fascinating.
Yeah.
I heard somebody say, and I would love to know your opinion on this, that because for a lot of people, like you were just mentioning, that, like, first trimester with their progesterone being really high, that sometimes they have more
Mhm.
bleeding. In that luteal phase after ovulation, the second part of people's cycle, progesterone is also like the dominant hormone. Do you see that some people, just like you were saying on their period, they might have more sensitivity to pain? Do you think that sometimes people have more like bleeding with brushing or procedures in that high progesterone phase of their cycle?
Yeah, I mean, it's hard to directly correlate
Yeah,
because a
for
lot
sure.
of women, when I
They
talk to
wouldn't know.
them, they're not like I'm like, "What day are you on of your cycle?" And
Yeah.
they're like, "Why are you asking me about my cycle?"
Yeah.
So it's a great thing, and it'd be something interesting to study for
Yeah.
sure, to find out for sure, but it wouldn't surprise me if there was some correlation for sure, and it depends from woman to woman, right?
Of
Because
course. Of course.
what level are they at? Like, there's some women who just have crazy levels just normally every cycle. And then there's
Yes.
others who just like blip up and down between normal. So it'd be interesting to see if it was, you had higher levels if you had more of the symptoms. But I
Yeah.
will say, if at any time, women, any time of their cycle, if you're noticing some bleeding or some things that you haven't noticed before, great idea to go in and get it checked out because the sooner that you're able to, um, usually the less involved the treatment is,
Yeah.
and you just don't want that inflammation in your body, and in the mouth,
Mhm.
that's one of the big things is, bleeding of the gums, or, another one would be, like, if you have a cavity that, maybe you haven't gotten taken care of, and
Yeah,
so we would never wanna leave any infection anywhere in the body,
for
including the
sure.
mouth, because I feel like sometimes if we had an infection in our finger, the doctor wouldn't be like, "Oh, don't worry about that one. We're just going to leave it. We'll take care of it in 6
Mm,
months." Like they'd be like, "No, like we need to treat that." But
yeah.
somehow in our mouth, maybe some people don't realize that an infection in there,
Yeah.
if it gets inflamed. So anyhow, if you notice any bleeding, bleeding's just a sign of inflammation. So make an appointment and get it checked out.
That's so good. Yeah, because I think that's really important. I think sometimes this, with a lot of things, but dental hygiene specifically, like sometimes we're like, oh, like whatever, like it's just my typical or my normal or it's what happens one time, and it's helpful to remember that those are things that should be checked out,
Yeah,
to
yeah,
make
for
sure
sure.
that we're living the best life as possible. Mm,
Absolutely.
so what is your like main goal for this sustainable, healthy living with the clients that you work with on a regular basis? So we
Yeah.
talked about
So
using like small steps, but tell us more.
we do, right, yeah. So we want them to hit all of the health parameters that is their goal. I'm very their goal based. Like I'm not one that's gonna say you have to be this weight and you have to be that's no, that's not what we're doing here, right? But we know already that heart disease, for example, is the most common cause of death for women. So let's look. What is your blood pressure? Is it really high? What do we need to do to get that into a normal range if that's a goal of theirs, for example?
Right.
So we really work on little steps, but what our end goal is different for everyone depending where they're starting. And we
Right.
know women with PCOS have a higher rate of heart disease.
Mm,
So they're already at an increased risk, never mind higher risk of anxiety and depression and, diabetes and, the list goes on and on. And
yeah.
so that's why, when I work with clients, I'm really working on what's their goal. Some women, it's like, I just went to my doctor and like, I found out I'm pre diabetic. Like, I had no idea. And they don't know what to do. And, usually it's like, we're going to check you in 3 months, but we need you to lose X amount of pounds. We need you to start exercising X amount of time, all these things.
Hmm.
And they really want to do it, but they don't understand how it's like all like correlated, like one thing to
Yeah.
the other. And then like, how do they put it into this busy, busy, full life that they have? And I have so much appreciation for other healthcare professionals, doctors, dentists, nurses, PTs, like you name it, like everybody is doing the best that they can. But
Yeah.
you only have limited time, like if you look at doctors, like they get 10, 15 minutes, right?
Right.
So if someone is now pre-diabetic and they need to make all these changes, like it would be really hard as a patient to like get down everything that they need to do and then be able to go
Yeah.
home and incorporate it all. So that's where coaching really comes in to like help you look at your individual and like what do you want to prioritize because success statistically doesn't come in when we do like an overhaul of our life at like 100%. We
Right.
tend to like fall off the wagon, so to speak. We
Yes.
might do good for a day or a week or whatever, but when we can work it in small steps and in areas that they're interested in working on, we can get the outcomes that they want or that they need to get for health purposes, but in a sustainable way and in
Yeah.
a way that they can carry on.
Yeah, absolutely. That's yeah, I think like you mentioned, like it's so there's so many amazing professionals out there and the way that our system works unfortunately doesn't always give them enough time to give all of that other information. And so people like you who are just like being able to sit with people and walk with people through just life and their health is really helpful and really amazing.
I love what I do.
Yeah, so good. What else about women's cycles and what you're working with, like tracking their health, do you find fascinating or that you're helping people feel empowered about?
Yeah, there is just lots of correlation. And some women that I'm working with, it depends because I work with a lot of women and they're at different stages, right? So
Right.
if they're newly diagnosed with PCOS, they might have not had a cycle for 6 months, two
Yeah, long
years, 5 years.
time.
Like it
Yeah.
can be a really long time, right? So that's different than, let's say, someone who's trying to get pregnant. And so maybe we've got to the point where they're having a cycle, but they're not ovulating. So then that's
Yes.
something different again, right? Or
Mhm.
maybe we're working with someone who's perimenopausal. So their cycle again is like all
Yes.
crazy. So
All over. Yep.
we really have to, again, individualize it.
Mhm.
What are they seeing? What do they want? I find for some people, they really love apps using, the tracking apps. But even if you don't want to do an app, even to just make note yourself of how long your cycle is it regularly that long? Like, is 1 month it's 21 days and the next month it's 75? And then how do you feel? Like, do you have less energy? Are you tired? Do you have crazy appetite? Like, there's just
Yeah.
all these things that you
Mhm.
can track. And sometimes that's giving it clues. I like to talk to women about, like, when we have symptoms, whether it's PCOS related or something different in health,
Mhm.
they're super frustrating. And I get that. And we want to just like fix the symptom,
Yeah.
but the symptoms are giving clues to what's going on in your body.
Mhm.
So they aren't just like random. So that helps you go to like root cause kind of things, right? And that's going
Mhm.
to be a lot more long term beneficial than just putting a band aid. So, like, for example, if I have a woman that wakes up and they're like, I got 9 hours of sleep. Like, it's a miracle. I got 9 hours of sleep. They're super excited, but they cannot get out of bed. Like, they are so exhausted and they need to use energy drinks or multiple cups of coffee or like that really heavy caffeine to try to get themselves up and going because they've got, you know, work to get to and, meetings and, all the things
Yeah,
that they need to
for sure.
do. That's telling us something, right? Because that's not normal, right? If we get a
Mhm.
full night's sleep, why are we still so tired, right? And
Yeah.
we want to fix that, but the fix, the long-term fix can't just be, using a stimulant like caffeine
Right.
or whatever to make that happen, right? So let's look at um why you still feel tired after a full night's rest.
Yeah,
Yeah.
absolutely.
So that's
Yeah.
more like my root cause kind of stuff rather than just putting a Band-Aid over it.
Yeah, which is so important because I think, like, that's like you said, like, it's so easy to put a Band-Aid over, all of our symptoms and just keep going with life, but being able to really advocate for finding those root causes and spending the time to find those root causes can obviously make us have a much healthier lifestyle, but, man, sometimes is it really tough to get there too, and figuring
Yeah,
that out.
absolutely.
Yeah,
Absolutely.
for sure. What else do you wanna share with people in regards to what you do and what you see on a regular basis?
Sure. I think I obviously myself and a woman, I want people to know that the work that I do is because I want to help other women.
Mhm,
I was diagnosed at 17, and the message that I was given when I was diagnosed is sometimes the same message that other women are getting at this time. And it makes me super, super sad because it's not even based in truth. When
mm,
I was diagnosed, it was like, this is what you have. I had never even heard of it, which
right.
a lot of people don't. And basically, they said, you probably won't be able to have kids and, come back and we can give it a try if and when you kind of want to. And that was kind of like the whole conversation.
Wow. Yeah.
And at that time, I was like, "What?" Like, you're 17, you're not even thinking about
Yeah.
necessarily having children or what that might look like or any of that. So it just, like, breaks my heart that I still hear all these women that have that or a similar story.
Yeah.
Because that's not true. A lot of women can easily go on to have children.
Right.
There are many who struggle, and, there's lots of reasons for that, and there's lots of treatments and, all those kinds of things.
Right.
But I don't want anybody to have that pressure from diagnosis to think that that is the way it is. So that's my motivation for everything. And
Mhm.
PCOS, unfortunately, is very, very, very common. Statistically, it depends what you read, but 1 in 10, some as much as 1 in 7 and 8 women have it. But 70% are undiagnosed.
That's so many.
And that is what's crazy to
Yeah.
me. So, a lot of the work I want to do is just like, these are the signs and symptoms. If you see any of these, feel any of these, have any of these, like, go get checked out, because I think knowledge is power.
Yeah,
And if you do have it, the earlier that you can start managing it, the better you are, right? Better off you are, and you can protect
for
your
sure.
fertility and, all those sorts of things. So that is really my passion, is just letting women know what it is, what
Mhm.
to do if you think you have it, and then we can go from there. We
Yeah,
can figure things out from there.
absolutely. So what are some of those things that you see that people need to, like, keep an eye out for to say that maybe this is something that they might need to look into a diagnosis for?
Right. So, abnormal periods, especially longer periods, 35 days plus, or if like 1 month they have a 21-day cycle and then it's like a 72-day cycle, that type of stuff for periods. Um, male pattern baldness, so losing a lot of hair, but like on the top of the head, not necessarily all over.
Okay.
Abnormal hair growth. So, like facial hair, or like on the stomach or the chest area, the back, any of those types of areas, and not like necessarily one hair. Like, I mean, it's significant. Acne, especially hormonal acne. So, that, kind of deeper kind of acne is another
Yeah.
sign that, they definitely want to look into. Unexplained weight gain is another one. Again, I hate to throw in all the statistics, but I think it's important. Like, a
Yeah.
lot of women, about 70% of women with PCOS have insulin resistance. And so that can make losing weight really difficult, and you
Mhm.
can gain weight really quickly. So that would
Yeah.
be another thing, that if women were like, okay, I'm doing the same thing, but in the last 6 months, I've put on like 15 pounds, that could be
Mhm.
another red flag, that, like, maybe you want to go in and see your doctor, your gynecologist, and have those things looked at, or a diagnosis of like insulin resistance. That's really
Right.
common.
Right.
So if you have that diagnosis already, then you might want to look if you have other symptoms to that. But yeah, those are just some of them. I could go on and on, because it feels like there's so many, there's
Yeah.
anxiety and depression and those kinds of things, but they can also just stand alone, or they could be part of something else.
Mhm.
But those are some of the symptoms that are kind of red flags for
Yeah.
PCOS.
Yeah, which yeah, those are good because I think sometimes when people don't know that those all correlate together to be like that,
Yes.
like all on their own, they're kind of like, oh, like that's kind of weird, that's kind of abnormal. But then when you put them all together and you realize that they're all connected, that that's really helpful for people to understand that those can be all together or just parts of it. But when especially if
Yeah.
people hit most of those things, then that would be a huge thing to reach out to somebody for.
Yeah, yeah, and you don't have to have all of them, because, like I
Yeah.
said, that's sometimes what's complex about
Right.
PCOS, is that there's lots of different, clinical ways that it shows up. There's not,
Yeah.
like, one
Right.
specific way. Mhm.
Yeah. And other than people working with somebody like you who has this knowledge base in health coach, what should
Mhm.
people look for in regards to other care providers for like gynecologists? Because I feel like sometimes not all gynecologists are going to have the same response to helping with a situation like this. And I know sometimes it's just like time, like we talked about earlier. But is there other
Yeah.
things that you suggest people to look for when they're looking for other professionals?
Yeah, for sure. So, depending on what your symptoms are and what you're trying to do, there's a whole bunch of professionals that can do different things. But if it's a real hormone based issue, an endocrinologist would obviously be someone. If it's the acne or hair loss or excessive hair, all of that, sometimes a dermatologist would be an appropriate person. As far as resources and places to look, there is fabulous information. You just want to make sure it's from an educational science based.
Yeah.
So I'm associated with the PCOS Awareness Association, so
Okay.
PCOS AA, and they are fantastic at vetting very great information, not just for who's diagnosed, but we have a lot of programs for like partners of women who
Mm,
have PCOS.
yes.
Our latest one is for teens or newly diagnosed, because that's a whole other thing, right? If you're
Yeah,
diagnosed at like
absolutely.
16 and you're already going through all the craziness of like adolescence, and then I was just working on some stuff with like as a parent, like how do you support a daughter who's been diagnosed with this, right? So there's lots of great resources. I would just say caution against anything that is um, this one thing will cure everything kind of
Yes.
things.
Yeah.
I know some of the younger, it's all TikTok and all that, and it makes
Yeah.
great content sometimes. But you just want to make sure that it's medically sound and that you're running anything you might be trying to use or do by a medical professional, whether it's supplements, whether obviously prescriptions they're going to know about, whether it's whatever you'd want to run that by your personal medical team or
Yeah. That's
professional.
absolutely. That's really it's so important to remind people of just like there's so many really cool things out there and there's so many things that are helping a lot of people, but
Yes.
especially when it comes to supplements and all of those other things, it's really important that you're checking to make sure that it's a good fit for you and that the specific product is reputable in itself.
Yeah, yeah, and there's standards of what you would want any supplement you were gonna put in your
Yeah,
body to be at,
for
you'd want
sure.
it to hit all the things. You don't want someone who's just, starting new in business, and it's a huge market. There's a lot of women out
Yeah,
there with PCOS, that really just want anything to, get their symptoms some relief from their symptoms.
right.
Another big thing, because there's so much mental health overlap with PCOS,
Mm,
is I'm a huge proponent of support groups.
yeah,
So I run a support group through my business,
awesome.
um, completely free. I am always happy to have people join, because I just feel like there is something in community when there's someone else going like, "Yeah, I have that too," or, "Yeah, I was dealing with that too," like, "It really sucks, but, this is what helped me," or, whatever. So, along with me having a support group, PCOSAA has also started a support group. It's virtual, so there's signups on their website, my website, all the websites if women are looking for support, and both of those are free.
Awesome. That's so good. I'll make sure that all those things get in the show notes.
Yeah, for
Um,
sure.
that's great. I am so glad that we're having this conversation, and I feel like we've talked about so many different things that people can just kind of know in the back of their head and think about what they should be doing. Is there anything else you want to leave people with?
I just love to leave women with, if something doesn't feel right, it's not. Trust your gut and find someone who can listen to you. Yeah.
Yeah, that's so important. Absolutely amazing. Okay, so where can people find you? I'll be sure to link everything that you mentioned, but where can people connect with you specifically?
Yeah, for sure. So I am obviously on my website, and I'm active on LinkedIn, and I've just started Instagram and then Facebook as well. And yeah, we talk about all the things. We talk about PCOS. We talk about women's health in general. We talk about some oral health, but like I said, it's really an add in. It's not like the
Yeah.
sole focus. And then I do a lot with the PCOS AA as well. I'm a on the board of directors for advocacy and programs. And so I do a lot of things there. So they are great. They have an app that you can get on as well. So those are all the places that you can find me.
That's amazing. Thank you so much for being here and sharing all of your wisdom. And if you're listening to this, please follow Christine and connect with her um, to learn more just about what she's doing.
Yeah, absolutely. Thank you so much. I appreciate being able to come on and talk. It's always fantastic to connect.
Yes, awesome. Thanks so much for being here today on the Cyclical Doula podcast. If this episode resonated with you, the most powerful thing that you can do is to share it. Send it to a friend, text it to your sister, forward it to that group chat. This is how conversations about our bodies start changing. Quietly, organically, woman to woman. If you are listening and thinking, okay, I want help applying this to my cycle, I offer free cycle clarity calls. It's a relaxed conversation over Zoom where we talk through your goals, your charting practices, and what kind of support that would actually make sense for you. You can book one at emma.com/free. And if you haven't already, make sure you're following or subscribe to the Cyclical Doula podcast so that you don't miss future episodes. And if you feel called to leave a rating or a review, it genuinely helps more women find this work. So thank you. You deserve to understand your body. You deserve to feel confident in your reproductive choices. And you don't have to figure it out alone. I'll see you next week. Thanks for being here.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to charting the low, your body's story is the star.